The CDC issuing a warning about severe illness and possible associated with things that are possible associated with the non-pharmaceutical use of chloroquine.
Joining us tonight with more on why we should be concerned about this drug and the trials that are about to get underway is Dr. Kevin Sneed from the University of South Florida's College of Pharmacy. Welcome, Dr. Sneed. Can you tell us about the alert from the CDC to pharmacists?
Yeah, absolutely. One of the problems with this particular medication is really the side effect profile. This medication has traditionally been used for people that have rheumatoid arthritis or other autoimmune disorders. So that medication around has been very effective, but there are many side effects.
So again, what is this drug primarily used for?
It's FDA indicated primarily for the use of as an anti-malarial medication for people that have autoimmune disorders like rheumatoid arthritis or lupus. We use it as an anti-inflammatory medication to treat those conditions, usually.
So what are your concerns about it for the use of coronavirus?
Well, this medication has an enormous amount of potential side effects. Anytime we initiate this medication, we really have to first get an eye exam just to make sure an individual doesn't have retinopathy. And this medication can cause ocular retinopathy in some patients. It can cause bone marrow disorders, respiratory disorders, and other conditions. So there's a lot of side effects that it can cause in people that are taking this medication.
Oh, that's serious. Is there an age range of patient? I mean, can children take it, elderly? Who can take this medication?
Yeah, usually this medication is taken from patients 18 and above. If you go lower than that, it really has to be a dire situation. I think in the current COVID-19 situation, it's primarily being seen as a medication that primarily can be used for people that have very acute and distressful disorders. So we don't use it to try and prophylact for them. We do use the medication to try and treat people who have very severe disease and potentially have no other options.
Is it an expensive drug?
Relatively, I'm going to say no. It's been generic. It's been out on the market for a very long time. We've been using it for many years. There is a little bit of concern now that ever since we found out about this medication possibly being a treatment for COVID-19, that people have been hoarding the medication. Physicians across the country have been prescribing the medication and keeping supplies of it on hand for some of their patients or maybe even family members. And so it's been very difficult to get from normal sources. However, I can say the federal government, through working with several governors, have supplied the medication to hospitals in several states just to make sure they have supplies on hand if a patient may need it.
Is there, really quick, is there some concern about rushing into trials to use this drug?
I don't know about rushing into trials. I think there's a lot of concern about just using it, number one, prophylactically, or number two, just thinking that it will actually be a cure for this particular COVID-19 disease. Some of the clinical trials going on right now, they've been originating up at the University of Minnesota. They're just starting the clinical trials right now. We don't have the answer, but we have to tell patients that this medication has not been cleared for treatment of the COVID disease. However, we do also want to make sure patients know that if a dire situation does occur, we're going to do anything and everything we can to treat that condition.
Excellent.
And this will be one option.
Thank you so much for joining us, Dr. Sneed. We appreciate that information.
Thank you very much.